The magnitude of mental health challenges in this country is significant. The recent housing census tells us that at least 12% of the people counted had what we call a probable mental health challenge. And 12% comes to about 5.5 million people. If you realize this number is even bigger than the number of people with HIV normally quoted, 1.5. Mental health problems, about 5.5 people or more. Those are just the people who were counted. Of all the patients we admit in the hospital, 30% have an addiction problem. That is the reason that brings them in. It is that number. So 30% of 1,300 on any one day you walk in, that is what you will find. We admit on average 20 patients a day and every day. So you can see that in a week, we shall have in excess of 100 people coming in every day. Every day we are admitting, Monday to Sunday. So the numbers are really huge. And I'm not mentioning those who come in and we see them and they go home. I'm talking about those who come and we get them admitted into our units. The majority of these individuals suffer the commonest conditions, including depression, anxiety, alcohol, and substance abuse problems. Of these 12% people, about 1% were reported to have suicide ideas. That's a huge number. About 1% were reported to have suicide ideas, which is a huge number. That means about 50,000 people in this country, if we didn't do something about it, could end their life. That is huge. When we look at our data at the Ministry of Health, in our health information systems, we find that the number of people with mental health challenges has actually gone up in 2024 at least, compared to 2020. So over the last 4 years, people with mental health problems resulting from alcohol and substance abuse went up by 15.8%. We are not talking about people who are drinking. We are talking about those who have drunk themselves into illness. That number has gone up by 15.8%. Now, in Butabika Hospital, among the patients we admit, about 30% have a problem of alcohol or substance abuse, an addiction problem. It's a huge proportion of the patients that we see.